A quarter to a third of men and women in the United States suffer from urinary incontinence. We really don't know how many for sure, and that's because many people don't tell anyone about their symptoms. They may be too embarrassed or think that nothing can be done, so they suffer in silence. We'll talk about urinary incontinence and some of the treatment options. Urinary incontinence is the leakage of urine from the bladder that you can't control. Incontinence may occur due to a number of conditions, both in men and women. For example, it's not just a medical problem, it can also affect the emotional and psychological and social life of the individual. In elderly patients, it can be a significant fall risk. Many people who have urinary incontinence may be too afraid to do normal daily activities or don't stray too far from a known access to a toilet. Urinary incontinence is generally broken down into a number of types, commonly described as stress urinary incontinence, urge incontinence, mixed incontinence, which is a combination of the first two, or overflow incontinence. Functional incontinence, which occurs primarily due to limitations in physical mobility that can subsequently result in loss of urinary control. So there's a number of general risk factors for urinary incontinence, and although incontinence may occur commonly as we age, it is not an absolute consequence of aging. For example, women have incontinence more than men in general, and conditions after pregnancy and childbirth and age changes that occur with the bladder and the vaginal area increase as we get older. Weight, being overweight, increases the risk of urinary incontinence. Smoking increases the risk. Family history, especially in those patients with overactive bladder symptoms or urge incontinence. Contributing factors, things such as diet, alcohol intake, caffeine intake, carbonated beverages, medications, commonly for heart or blood pressure control, may increase urine output and subsequently increase the risk of urinary incontinence. Urinary incontinence may also be caused by an easily treatable medical condition, such as urinary tract infections, which can irritate your bladder or cause you to have strong urges to urinate and subsequently developing incontinence. Constipation, that can affect the rectum, which is located near the bladder and shares many of the same nerves as the bladder. So hard or compacted stool in your rectum causes these nerves to be overactive or sometimes underactive and increase urinary frequency. Now, what are the treatment options for urinary incontinence? Well, starting points to consider will include risk modification. Urinary incontinence isn't always completely preventable. However, to help decrease your risk, general principles would include maintaining a healthy weight, practicing pelvic floor exercises, which we've talked about previously, avoiding bladder irritants such as caffeine or alcohol or acidic foods, eating more fiber, which can prevent constipation and cause urinary incontinence. Of course, smoking or quitting smoking is very important. Seek help to quit smoking. So treatment for urinary incontinence depends on the type and its severity and the underlying causes. So a combination of treatments may be needed. And if an underlying condition is causing your symptoms, your doctor will first treat that condition. Your doctor is likely to suggest the least invasive treatments first and move on to other options if these techniques fail. Things such as behavioral techniques, double voiding to help you learn to empty your bladder more completely and to avoid overflow incontinence. Double voiding means urinating, then waiting a few minutes and trying again. Or scheduling trips to the restroom to urinate every 2 to 4 hours rather than waiting for a sudden urge, being sent by the bladder at a very inopportune time. Fluid and diet management to regain control of your bladder. You may need to cut back on or avoid alcohol or caffeine or acidic foods, reducing liquid consumption during certain times of the day, losing weight, And increasing physical activity also can ease the problem with urinary incontinence. The pelvic floor muscle and exercising that pelvic floor muscle, your doctor may recommend that you do these exercises frequently to strengthen the muscles that also help urinary control. These are known as Kegel exercises, and they're especially effective for stress incontinence that may help also with those with urge incontinence. To do the pelvic floor muscle exercises, or Kegels, imagine that you're trying to stop your urine flow. So you tighten your muscles, contract, count to 2, sometimes even up to 5 if you can, and then relax for 5 seconds. If this is too difficult, start holding for shorter periods of time, 1 or 2 seconds, and then relaxing for 3 seconds. And work up the time frame of your contractions to hold even up to 10 seconds at a time. Aim for at least 3 sets of 10 repetitions each day. You can do it certainly more often without any harm. To help you identify and contract the right muscles, your doctor may also suggest that you work with a physical therapist or try biofeedback techniques. Electrical stimulation procedures or devices are available. Medications are also commonly used. Some of these are called anticholinergic medications, and these can calm an overactive bladder and may be helpful for urge incontinence. Some of the names you may recognize are Myrbetriq. There's others that are called alpha blockers, which are typically off-label use in women. And topical estrogens in women may be helpful. There are medical devices that are commonly used. Pessaries, which we've also talked about here before. There's devices that are designed to treat with women with urinary incontinence, urethral inserts, and pessaries also may be helpful again for physical stress incontinence. There's interventional therapies, sacral nerve modulators, tibial nerve modulators, which is the nerve behind the ankle bone. If you stimulate these nerves, it sends a signal back to the bladder and through the spinal cord and helps to inhibit overactivity of the bladder. Other types of therapies are minimally invasive, and these could include bulking material or injections. This is inserted through a cystoscope or a small device placed through the urethra under local or sometimes monitored anesthesia, and kind of acting like a sphincter on the iris on your eye to help close the urethra down and provide better closure to the urethra. Botulinum toxin or Botox is commonly administered into the bladder, and it can be very effective with overactivity of the bladder. And again, other nerve stimulators can be very effective for overactivity of the bladder. Now, for stress incontinence, the surgical treatments are bulking agents, midurethral slings, and other slings that can be used using your own fascia, are called a pubovaginal sling. And there's another surgery that's commonly approved and part of guideline criteria, and that's called a Birch colposuspension. Other surgical procedures for more complicated cases may include procedures that cover the repair of pelvic floor prolapse in men or in women, or in men with stress urinary incontinence following prostate removal, for example, or other surgical treatments. We can provide sling procedures in men as well. Or for more severe degrees of incontinence in men, artificial urinary sphincters or valves which are placed around the urethra can help them. Absorbent pads and catheters are options if medical treatments can't completely eliminate your incontinence. You can also try products that help ease the discomfort and inconvenience of leaking urine. Pads and protective garments. Most products are no more bulky than normal underwear and can easily be worn under everyday clothing. Men who have problems with dribbles of urine can use a small collector, a small pocket of absorbent padding that's worn over the penis and held in place by close-fitting underwear. Of course, we'd like to try to avoid these, and that's our objective here. Sometimes we end up using catheters if you're incontinent because your bladder doesn't empty properly. Your doctor may recommend that you learn to insert the catheter into your urethra several times a day to drain your bladder. And this may be better than leaving a catheter indwelling. You'll be instructed on how to clean these catheters for safe reuse or obtaining catheters for intermittent use. At Northwoods Urology, we understand the importance of urologic health. Visit our website for more tips about urinary incontinence. If you suffer from any of these symptoms and would like a professional approach, contact our office for an appointment.